having me. This is always a treat. It's really cool to be here. Again, my name is Sam. I'm a prior patient of Dr. Gulani's. 10 years post-surgery with the LaZrplastique. I do a lot of stuff dealing with night vision, and within the night vision realm, we're dealing with the human eye and the anatomy of the eye. So my world is all photoreceptors and rods and cones and rhodopsin and fovea and all that stuff. So I am not a subject matter expert on the eye like this gentleman right here, but I'm very much a layman, but I probably have just enough knowledge to be dangerous. But what I get asked from students who find out I have had LaZrplastique is, how is it different than PRK? So,
sure.
Doc, take it away.
Absolutely. It was great seeing you, Sam. And you brought your wife here today for evaluation. This is 10 years post-op.
She's down the hall getting assessed and evaluated, and it's interesting to see how the technology's changed and the battery of tests that they've put her through. And you know, you're custom tailoring the stuff for her eye. It's really cool.
And again, see, I'm planning something else for her.
Yes.
Surgery-wise. So that's very important. So great to be here. It's actually, again, middle of a weekday as always, but always time for my lovely and dear patients and my own Mona Lisas when they come back, and your questions. So this is impromptu as always, no scripts, nothing, and we're chatting. So LaZrplastique, when I started performing this procedure, Sam, now it's nearly 3 decades. You know, I was among the first in the world to do LASIK surgery with my international privileges, even way before FDA approval in the US.
Sure.
And by the time it got approved in the US, 94, 95, I had already designed LASIK complication instruments because I had become the place where people would fly their complications to, because people were jumping on the LASIK bandwagon. Easy surgery, easy money, and complications no one knew how to handle.
Right.
So that's how. And I was very thrilled with my LASIK outcomes. You know, I custom designed my LASIK, the flaps, thickness, I used to love all that. And my patients, I used to always see that they saw better than 20/20. So I was thrilled with my outcomes, but I kept wanting to do a procedure that wasn't involving cutting, because I believe that cutting the cornea limits you to how many people you can help, and also correcting these irregular and abnormal corneas or complexities, like previous surgery, like radial keratotomy, keratoconus. So as I was gaining notoriety, just, you know, I don't advertise anything, but just on its own, and seeing complex corneas and fixing them, I started performing this surface laser surgery for scars, irregular corneas, radial keratotomy, LASIK complication patients who were referred to me. And I found them having excellent results with these surface surgeries. And I was fascinated that 1, I was not cutting their cornea, 2, I was sculpting them with a refractive mindset, 3, they were healing additionally with their cells of their own,
Right.
what I call new carpet, not broken tiles. And then here was another fact. None of the patients were in pain.
Yeah.
So I was so fascinated by this that I said, this has to be the future. And why won't I apply this from complex corneas and complication cases to normal people?
Sure.
That's when I started applying this on normal people who came with nearsightedness, farsightedness, astigmatism, and reading vision issues. And I was blown away. The results were amazing. Beyond 20/20 vision. I, till today, thank God, have not had to retreat a single patient. 3 decades.
Yeah.
Huge, that is huge, especially given the level of complexity of cases I see. And none of the patients in pain. So I reached a point where I went, this is the future. But I also, as you know, love to share and teach. I want other doctors to take advantage of this. So I gave it a name and I trademarked it, copyright. It's called LaZrplastique. If you realize, the name is difficult for a patient to use. And for a reason, I made these as a super specialty of LASIK for my colleagues. So it's not an easy name to advertise, because no one knows how to even say it, LaZrplastique, or how do you. So because I don't advertise, I gave it that classification to teach doctors that there's another technique you must learn, which is much better. The fact that it wasn't causing pain like traditional PRK, the fact that it wasn't causing regression, meaning the numbers coming back and you have to retreat people like PRK, the fact that it wasn't causing haze and scars like PRK, this had to be different. In fact, I was using it in patients with haze and scars and PRK complications. This also doesn't cause dry eyes. So unlike LASIK, where you have to cut a flap, and most of the complications of LASIK are due to flaps, cutting the flap, whether it's with laser or blade.
Sure.
Also, it causes dryness because of the cuts. Also, you can have other complications. There's no cuts, there is no haze, there is no pain, and I can treat practically every refractive error and irregular and complex corneas. So I was so taken aback by my own success, if you may, I started recording every patient. You too, remember? 10 years ago, and you with your sharpshooter rifles, the sniper stuff and all that. And then I did something even more difficult for me. I started recording these patients before, immediate, post-surgery, and years later when they come back, to constantly share with my colleagues. And then we started recording them here with no pain. So day one post-surgery or post-op, we used to sit down and videos, straight on videos. Do you have pain? And they would go, no. So how can it be that the surgery that I can do on majority of people with tremendous success, no retreatment, thank God, no complication, no regression, this has to be the future. Now, this can also fix complications of Lasik, SMILE, PRK, radial keratotomy, you name it, every surgery.
There were several people on the day of surgery that flew in who had prior complications, I remember.
Right, and till today, 30 years later, still continues every day. Today also, how many people flew in, flew out.
Yep, people.
But the pleasure is, so LaZrplastique is a super specialty of vision corrective surgery. I don't advertise, so maybe that's what's missing as far as pushing it to people. But because I don't believe in that, I believe in what's right for the patient. Like here's my amazing patient, LaZrplastique, 10 years later. But his wife, I'm doing something else. Because there are over 40 techniques to help people see without glasses, right? So in summary, LaZrplastique is an elegant eczema laser procedure with micron precision, removing the least amount of tissue with the largest ablation zone. So it helps night vision too. Can correct all refractive errors, near, far-sighted, astigmatism, reading vision, and complications of premium cataract surgery or previous refractive surgery like Lasik, radial keratotomy, SMILE, and conditions which were called nothing can be done, keratoconus, corneal scars, irregular astigmatism. Gave you a long lecture, right?
Right.
Impromptu long lecture.
And for those of you, listening, watching this, he can talk till he's blue in the face, and I can talk to the merits of this surgery till I'm blue in the face. But truly, seeing's believing. Once you experience, better than 20/20 vision, it's going to change your life for the better. Like I can think of no downsides.
No, and remember at your time, because of your profession, you're always in dangerous situations.
Right.
There is no flap that can move and damage your vision.
Correct.
If God forbid you get caught in some absurd area by some bad people, there's no evidence of surgery.
Right.
So there's nothing anybody needs to do once you're operated by me. You go back and there's nothing to be done.
You just live your life.
You just live your life to the fullest, because there's no change. There is no flaps that can move or damage your vision or trauma. And you can be in any profession. You can go scuba diving, mountain climbing, you're just a normal person after that. And I have used your best vision potential. In many cases, even beyond 20/20. We've even done people with infectious corneal scars, contact lens infections, herpes corneal scars. I mean, all of this is up in all our media because I still believe in this. And I've seen patients now, all of us are decades old, patients coming back. And all ages can be done. I've done a patient who was 100 years old with LaZrplastique.
Wow.
Where's the limit? If they have potential,
Yep.
perform. And is the surgery painful?
No.
How long was the surgery?
20 minutes.
I
mean,
surgery itself.
60 to 90 seconds.
Exactly.
Something like that.
So seconds to minutes literally, and there's no cutting, no chopping, no blackouts, no pressure, no causing a threat to the retina. All of these, literally any patient with failed refractive surgery can be corrected. Any patient who's told they're not a candidate and they have potential can be corrected. And virgin eyes can absolutely be corrected and safely with LaZrplastique. So it's my passion, having pioneered this technique. I want other doctors to adapt this because it's a safer, more predictable, and the right way to go.
Couldn't agree more. Like you'll get no complaints from me. So I mean, here we are, 10 plus years later. I can do everything that I've wanted to do. It's awesome. Like it's, again, no downside. I guess a little bit of anxiety prior to surgery is probably normal.
Right.
But then after surgery, you're like, that was it?
Correct.
No big deal.
Correct. So it's been a pleasure. I think your wife should be ready now, and we'll keep it up.
It's always a
Absolute
pleasure.
pleasure.